And good morning, everyone. My name is Mary Ennis, and I am the Outreach Coordinator for Seniors NL. One question, can you see my slides? Perfect, thank you. Welcome to this week's Let's Talk About, and today we'll be talking about a very important topic for all of us, keeping our hearts healthy. And I don't think I'm very good at that, but I'm going to learn a lot this morning, I'm sure. Our weekly Let's Talk About and Just Ask sessions are supported by United Way Newfoundland and Labrador, to whom we are very, very grateful. And before we move on, I just want to cover a few brief housekeeping items with you. Please keep your microphones muted to block out outside noises. We've had cats and dogs and everything on our Tuesday morning Zoom session, and we don't understand what they're saying. There's captioning at the bottom of the screen for anyone who needs it. If you have any questions or comments during the presentation, you can put them in the chat box, also at the bottom of the screen. And once the presentation is over, Jeremy and Melissa will start to address them. And as you know, the session is being recorded. One other thing, I just want to let you know that if anyone has a topic that they would like to know more about, just send it to us and we will see if we can have one of these Zoom sessions around that topic, okay? We really want topics from the community, not from, we don't just want to, make them up ourselves. And I just want to take a minute now to do the land acknowledgement. We respectfully acknowledge the land on which we gather as the ancestral homelands of the Beothuk, whose culture has now been erased forever. We also acknowledge the island of Uktuhumguk as the unceded traditional territory of the Beothuk and the Mi'kmaq. And we acknowledge Labrador as the traditional and ancestral homelands of the Innu of Nitassinan, the Inuit of Nunatsiavut, and the Inuit of Nunatukavut. We recognize all First Peoples who are here before us, those who live with us now and the 7 generations to come. As First Peoples have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all of us. During the registration part of this process, we invited responses to 2 questions. And of the 25 responses we received to the first question, which was, do you understand how high and low blood pressure can impact the human body? 25 people responded, 17 said yes, which is very good, 2 said no, and 6 were unsure. The second question we asked was, do you understand the role of cholesterol in the human body? And we had 23 responses to that. 6 said yes, 5 said no, and 12 were not sure. So I think we probably all need a good education about cholesterol for sure. And I'm not really as confident that I know everything about high and low blood pressure either. But anyway, when I was preparing for my notes for the Zoom session, I wondered just how much I don't know about cholesterol and blood pressure. So I went online to compare my perspective of each with what the reality of each is. And I came up with lists of myths, I guess, misconceptions about both cholesterol and blood pressure. The things that, the things that people might think are true, but they're not really true. And so I picked out a few of them to share with you. Some of the myths or misconceptions about cholesterol. Cholesterol is not a concern for children. Now, I would never have thought about cholesterol as being a concern to children, but apparently it is. Thin people do not have high cholesterol. So no matter how much weight you're trying to lose from time to time, think about your cholesterol. With medications, no lifestyle changes are needed. And unfortunately, it sounds like it doesn't work that way. If the nutrition facts label shows no cholesterol, the food is heart healthy. And using margarine instead of butter will help lower cholesterol. And I hear people saying that all the time. Oh, I don't use butter. But anyway, I always thought it did, it did help lower cholesterol. And then when it comes to high blood pressure, a lot of people say high blood pressure is not a big deal. High blood pressure cannot be prevented. High blood pressure is okay as long as one number is normal. And also, another myth is treatment does not work. I would like to hope that treatment for anything is going to work. Anyways, let's erase any of the myths or the false conceptions we might have about cholesterol or blood pressure and listen as today's presentation tells us the facts, not the myths. And as we move along, once more, you can put any questions or comments in the chat box, and we will get to them when we're all finished here. And now I just want to take a few minutes to introduce you to our guest speakers. And first we have Jeremy MacDonald, originally from Burgeo, Newfoundland and Labrador. Jeremy is a pharmacist in St. John's. He obtained a BSc in pharmacy from Memorial in 2017 and is currently enrolled in Memorial's PharmD for Working Professionals program. Jeremy has worked as a community pharmacist in Western and Eastern Newfoundland and Labrador, as well as on the Great Northern Peninsula. And he's currently a pharmacist at Memorial University School of Pharmacy's Medication Therapy Services clinic. And actually we had someone from there on, I think, a couple of weeks ago. The MTS clinic is a non-dispensing pharmacy located in St. John's, Newfoundland, Labrador that provides comprehensive medication therapy assessments and de-prescribing assessments to people all across the province. The goals of those in-depth medication assessments are to provide their patients with education about their medications and to make recommendations for improving medication safety and effectiveness. The MTS clinic also works closely with geriatric medicine here in St. John's and provides recommendations for safe and effective medication in our older adult population. And welcome to Jeremy. And then we have Melissa Kieley, originally from the Goulds in St. John's, and she's a fifth-year PharmD student at MUN. She obtained a Bachelor of Science in Biochemistry, Nutrition from Memorial in 2016, and is currently completing her final year of Advanced Pharmacy Practice Experience rotation. Now, Melissa is looking forward to graduating next May with her PharmD and becoming a pharmacist, hopefully here in this province, if not in the city. And I think that's all I have to say about our two presenters. So I am going to stop sharing my screen and let them get started with theirs. Okay.
Okay. Okay, can you hear me and see my screen?
Yeah.
Yeah, okay. So thanks so much, Mary, for the introduction. Again, my name is Jeremy. I'm one of the pharmacists here at the Medication Therapy Services Clinic located at MUN School of Pharmacy. And we also have Melissa Kieley with us, who's a final year pharmacy student who's completing a rotation here at the clinic. She's actually finishing next week, so we're going to miss her when she goes. So today we're going to talk about heart health in terms of reviewing your medications and your lifestyle for improved blood pressure and cholesterol management. So just a brief overview of the presentation. We're going to talk about hypertension or high blood pressure, and we'll discuss the importance of monitoring your blood pressure. We'll discuss blood pressure medications as well as lifestyle measures you can take to manage high blood pressure. Then we'll move on to dyslipidemia, which is the medical term for high cholesterol. And we'll discuss the importance of managing your cholesterol medications, as well as lifestyle measures to manage your cholesterol. So like Mary actually mentioned with the myths of these medical conditions is that they're not managed solely by medications. They also require you to, maybe make some adjustments to your lifestyle to help you better manage them. And then we'll finish off discussing how your pharmacist can help you with managing these medical conditions.
Hey, thank you, Mary and Jeremy, for the introduction. So like Jeremy and Mary mentioned, my name is Melissa, and I'm a final year pharmacy student at MUN School of Pharmacy, and I'm doing my rotation at the MTS clinic with Jeremy as my preceptor. So it's been a really good rotation so far. So the first thing that we'll discuss today is high blood pressure, and high blood pressure is also known as hypertension. So hypertension occurs when there is too much pressure in your blood vessels. And we can kind of compare this to when you pump too much air into a tire or a balloon. So when you have all of this extra pressure, your heart has to work extra hard. So this can increase our risk of certain types of heart disease, like heart attack, stroke, and heart failure. But it can also cause other problems, such as dementia, kidney disease, and eye problems as well. So to kind of get us started here, I have a little true or false. So feel free to type your answer in the chat or just think about it in your head. So true or false, people with high blood pressure will often experience symptoms like nervousness, sweating, and flushing. What do you guys think? So the answer is actually false. Most people with high blood pressure will actually not experience any symptoms. And this is often why hypertension is referred to as a silent disease. So the best way to actually know is if your blood pressure is high is to measure it. That being said, if your blood pressure is really high, some symptoms that you can look out for are dizziness, headaches, fatigue, and difficulty breathing.
Okay, so in discussing blood pressure, an important thing to talk about are our blood pressure targets. So if we're taking blood pressure medications, our typical blood pressure target, those two numbers that you see on a blood pressure monitor, are 120/80 or 130/80 if you have diabetes. Okay, so if you ever check your blood pressure and just say you're not on blood pressure medications and you notice that your numbers are higher than these numbers shown on the screen, then it's certainly something to have a conversation with your healthcare provider to let them know. It's not necessary that you have to go on blood pressure medications if your numbers are, say, a little bit up, but if they're trending upwards over a few readings, or if they're really high, that may be a discussion to have with your healthcare provider and to come to a decision if you need to go on blood pressure medications, or if you are on blood pressure medications and your numbers are high, that can be where you can discuss changing your dose of your medication, or looking into other lifestyle factors to to help bring down your blood pressure. So when talking about those two numbers, I know a lot of times people will say, "Oh, my numbers are good." They're not keeping track of what their readings are, and I really encourage patients that come by to try to write down their numbers and look at what the numbers are and if they're up, because that can sometimes help motivate you to get your blood pressure under control. And the only other thing I'll add here is, what does 120 mean? What does 80 mean? So the 120 is the pressure is your blood pressure when your heart contracts. So when your heart contracts, it pumps blood out of your heart into your arteries that will go around your body. So that's the pressure when your heart contracts. The second number is when your heart relaxes, and that's when it refills up with blood. Okay, so that's what those two numbers mean when you see them.
So now that we know what our targets are, it's good for us to keep those in mind when monitoring our blood pressure. And this is especially important if you are on blood pressure medications, that to keep a good eye on your readings that you have. We often tell patients, keep a log of your blood pressure, write it down in a notebook. If you have an appointment with your healthcare professional coming up, you could keep a log for 7 days and maybe do the readings 2 times a day, maybe once in the morning and once in the evening. And that gives, your healthcare professionals a better idea of the trends that your blood pressure it has, how it fluctuates throughout the day. And it can give them a better idea if they need to adjust your medications, and can give you us a better way to, manage our lifestyle choices to see if we need to adjust our blood pressure. When you are monitoring your blood pressure, though, it's really important that you don't smoke cigarettes or drink caffeine in the 30 minutes before you tend to monitor it. And that's because these things can actually increase our blood pressure and they can give us an inaccurate reading. So you want to avoid that for 30 minutes before you monitor your blood pressure. When you are actually measuring your blood pressure, it's important to keep in mind a good blood pressure measurement technique. So in the picture here, you can see you should be sitting with your back supported on a chair. You want to have your arm bare, and that helps us give us a more accurate reading. You want to make sure that the cuff size is appropriate for your arm. And there is usually a standard size that is good for most adults, but sometimes you may need a bigger or a smaller cuff size depending on the size of your arm. The middle of the cuff should be at heart level. So you can see it's kind of resting on a table in front of the person in the picture there. And the lower edge of the cuff should be 3 centimeters above the elbow crease. When you actually have the reading happening, you want to make sure you're not talking or moving. That should be a little bit before and during the measurement. You want to have your legs uncrossed and your feet flat on the floor. If you don't already have a blood pressure monitor at home, you can get them at your local pharmacies, Walmart, those sorts of things. But it is good to look for monitors that have a Hypertension Canada logo, and you can see the logo here on the bottom. This just makes sure that they're more appropriate monitors for accurately getting our blood pressure readings. And if you're unsure, if your monitor is good or which monitor to buy, you can always ask your pharmacist to help you with that as well. So now we're going to discuss, the main medications that can be used to treat high blood pressure. There is lots of medications that can be used. So we'll just kind of discuss the 4 main classes. And those are ACE inhibitors, diuretics, beta blockers, and calcium channel blockers. So the first class here is ACE inhibitors, and these are medications that end in pril. So some examples could be ramipril, or the brand name Altace, lisinopril or Zestril, and perindopril or Coversil. And these medications work to lower our blood pressure, but they can also be used to protect our heart and our kidneys, especially in patients with diabetes. I will mention, though, that a side effect of this medication is a persistent dry cough. So if that is something that you're experiencing, it's something that you would want to let your healthcare professional know, and they can help you discuss ways to manage this. The next class here is beta blockers, and these are medications that typically end in olol. So for example, metoprolol or Lopressor, atenolol or Tonormin, and bisoprolol or Monocor. And these medications work by decreasing our heart rate in order to lower our blood pressure. And since they decrease our heart rate, they can be used for reasons other than having high blood pressure, such as protecting your heart after a heart attack or to improve your heart function if you have heart failure. However, since they do decrease our heart rate, when you start them or when your dose is increased, they may make you feel a little bit more tired than what you normally do. And that's just a normal side effect of this medication. They can also mask the signs of hypoglycemia or low blood sugars if you have diabetes. So one symptom of having low blood sugar would be, having a racing heart. And so since these medications can lower our heart rate, we might not feel that we have this when we have low blood sugar. So if you do have diabetes and you're on these medications, it's always important to test your blood sugars if you feel like your blood sugars may be low.
Okay, so now we'll move on to diuretics, which are also known as water pills. A lot of people will say they're on a water pill, and sometimes it's used to get fluid off the body, but can also be used to help control your blood pressure. So some examples of some water pills are hydrochlorothiazide, sometimes referred to as hydro or HCTZ, and dapamide or chlorthalidone. So these medications work by decreasing the volume of fluid in our bodies, and this helps to decrease our blood pressure. So, Melissa mentioned earlier caffeine and smoking before you get your blood pressure checked can raise your blood pressure. Your blood pressure is very dependent on a lot of different things. You could check your blood pressure right now, and you could check it 5 minutes later, and it will be a different reading. And that's because it's your blood pressure at that moment in time that you're getting it checked. So that's why Melissa noted earlier, the benefits of recording it in a notebook so that, your healthcare providers can look at trends in your blood pressure. So with diuretics, beta blockers that Melissa just mentioned help to slow down our heart rate to reduce the rate at which the blood is flowing through. And that in turn helps to decrease the blood pressure. But by actually getting fluid off the body, that also decreases the volume that's in your blood vessels, which will help to decrease your blood pressure. Okay. An important thing to note with water pills is that you typically should take them earlier in the day, and that's to avoid having to wake up in the nighttime to use the washroom. That's something we want to avoid as much as possible. And the fourth class of blood pressure medications we'll discuss are calcium channel blockers. So this one's a bit of a unique class of medication, and the fact that we kind of have like two subgroups of blood pressure medications within the one class. Okay, so an example would be amlodipine or nifedipine. You can see they kind of end in the same ending there, right, with the dipene. And these medications are similar in the fact that they work to relax our blood vessels to reduce our blood pressure. So what I often tell people is, if you cram 20 people in a small room, that's a lot of pressure. That's a lot of people in a small room. But then if you take those 20 people and you put them in a bigger room, a gymnasium, there's less pressure, it's less congested. So that's kind of how they work. They help to relax your blood vessels to make them larger, to help reduce your blood pressure. Okay. The other two types of calcium channel blockers we have are diltiazem, commonly known as Thiazac, or verapamil, also called Isoctin. So these work in the same sense that they help to relax our blood vessels, but they also work by reducing the force of our heart rate and contractions of our heart, and this will help reduce our heart rate and our blood pressure. Okay. A potential side effect of the first two medications I mentioned there is swelling in the legs. So that's a really important thing to let your healthcare provider know if you're on these medications, if you're noticing any swelling in your ankles or in your feet or in your legs, because sometimes this could be a side effect of the medication. Not always, but it is a potential side effect. Okay. Another thing to note is the nifedipine tablets, or Adalat. You notice in the name there we have XL after, and that means that it's like an extended release. So there's a capsule around the tablet that kind of goes all through your body to help slowly release that medication into your body. And for that reason, you don't actually digest the shell. So you may notice the shell in your stool when you use the washroom. So it's not alarming. It's a normal thing that can happen when you're taking that medication. Okay, so now we'll discuss lifestyle management, which should be used in addition to any medications. And typically this is what's recommended first to help manage these conditions. And, then sometimes we need additional medications such as, or additional help such as medications to help lower our blood pressure. So other ways we can lower our blood pressure is by incorporating physical activity into our, into our daily routine, weight management, eating healthier, and by lowering our salt intake. If we consume alcohol, then moderation in alcohol intake, using relaxation therapies, and quitting smoking, if we smoke cigarettes. So physical activity, what I like to tell people is, if you're not very active, it only takes a small amount of physical activity to really have a big impact on your blood pressure. So, even going for a walk 3 times a week, pick 3 days, maybe a Monday, Wednesday, and Friday, and just go for a 20-minute walk. Over time, you might be able to do a 30-minute walk, and it doesn't need to be, a fast-paced walk, or an extended a long walk. Just a short walk helps to get our heart pumping and raising our heart rate, and that can help better improve our blood pressure. Those that are able to can even, look into incorporating hiking. So maybe, on a Saturday afternoon, go for a couple hour hike. Doesn't need to be too strenuous, but that can be another thing that helps to improve our blood pressure. And swimming is another thing. So swimming is really good for, keeping yourself physically active, but also helping with things. Maybe you have arthritis in some of your joints, and going for a swim can be really helpful because the water kind of resists your movements, and that helps with your muscles and helping to maintain your muscle function and your joints. And then community programs. I'm sure Seniors NL has a lot of different community programs that you can get involved with to get out in your community and to be active. So these are ways that we can help to manage our blood pressure. So in addition to, physical activity and getting involved, in our community, eating healthier is a great way to improve our blood pressure, because, it's like a pill. The effects of a pill in your body are one thing, but the effects of your food are another thing to keep in mind when you're planning out your meals. So there's something called a DASH diet, and DASH stands for Dietary Approaches to Stop Hypertension. Okay. This is an eating plan that is rich in fruits and vegetables, low-fat dairy products, and whole grain foods. Okay, and it's a plan that is high in fiber with a low to moderate fat diet, and is rich in potassium, calcium, and magnesium. So this diet, if you're looking up the DASH diet and different foods to be eating, it is available online on Hypertension Canada, or you can look up, High Blood Pressure Canada, and you should find it. Excuse me, but also look into making an appointment with your local dietitian. So that could be, at your local grocery store, could be through your health authority, and they can kind of walk you through the foods that you are eating and make suggestions for ways to, improve your diet. Okay. Another thing that Melissa will talk about now in a second is actually checking food labels and choosing foods that had the lowest amount of sodium and saturated or trans fats. So, if you're looking at canned soups, for example, look for the soup cans that are marked with low sodium. So that would have less salt in it. Okay. And we also recommend trying to reduce or limit the amount of processed meat that are high in sodium, because they use sodium to kind of keep them preserved. So it's not saying cut it out completely, but trying to limit your use, your diet with salty foods, and eating in moderation.
So to kind of go off of, on eating healthy, one thing to help us to make us eat healthier as well is to monitor our salt intake. So Hypertension Canada actually says that in order to lower your blood pressure, you want to aim to reduce your salt intake to less than 2,000 milligrams per day. And sometimes it's really important for us to look at the nutrition labels, like Jeremy mentioned, on our foods that we're eating. And specifically, it's good to look at our daily intake, the percent of salt per serving for our daily intakes that we're using. So sometimes when you look on the label, you might see foods that have greater than 15% of our daily intake of sodium. And those are foods that have too much salt, especially if you're looking to, lower your blood pressure. So those are foods that you would want to avoid. So if they're greater than 15% of your daily intake of sodium, you should avoid those if you can. Foods that have between 6 and 14% of your daily intake of sodium, those are other ones that you want to have in moderation. So you want to limit those. It's not something you want to have every day, but of course, moderation. And foods that have between 0 and 5% of our daily intake of sodium, those are ones that are good. You can go ahead and eat those because those would be considered low sodium options. And it's like I mentioned, it's really important for us to look at these nutrition labels, because sometimes we don't realize how much salt there really is in different types of foods. And so over the next week, we do challenge you to take the time to actually write down your salt intake. So write down the amount of salt you're having throughout the day and see if you're meeting this 2,000 milligrams per day target, just to kind of keep this in mind. It's really important to monitor this going forward. And to illustrate this, sometimes we don't realize how much salt is in items. So I just have an example here of Sue's diet. So Sue's diet for breakfast, she had 2 scrambled eggs and a slice of toast with butter. And in this meal, she had about 450 milligrams of sodium. For lunch, she had a bowl of chicken noodle soup with 6 salted crackers, and that is 1900 milligrams of sodium. For supper, she had a chicken breast with half a cup of rice and soy sauce, and this is 1100 milligrams of sodium. And then as a snack in the evening, she had a small bowl of potato chips, just 15 chips, and that was 170 milligrams of sodium. So throughout the day, Sue's total daily intake of sodium was 3,620 milligrams of sodium. So this is almost double what hypertension recommends of 2,000 milligrams per day. And this is not really a lot of food. So it is really important that we're thinking about this going forward and writing down what we're having throughout the day, because we don't often think about this when we're just eating them. So it's good to actually look at our labels and think about how much salt we're having. So this is an example of a nutrition label that we've been talking about. So this is for a regular chicken noodle soup. And you can see in the sodium here is circled, there's 890 milligrams of sodium. And this is 37% of our daily intake. So like I mentioned, foods that are above 15% of our daily intake are the ones that we want to avoid. So we want to try and have those foods that have low sodium. And like Jeremy mentioned, there is usually labels that says low sodium. So if you have high blood pressure, those are some things that you should reach for. When you're going forward this week, record your salt intake on a notebook if that's something that you'd be interested in. Or if you're more tech savvy, you can also download an app. So an example of an app that you can use to monitor your sodium intake is a Sodium Tracker, which is a free app. And you just want to monitor your salt intake and aim for 2,000 milligrams or less throughout the day.
Okay, and another lifestyle measure that we can take is quitting smoking if we smoke cigarettes. So there are many resources available in the community. So there's a smokers helpline, there's the smoking cessation clinic, which is actually located in the same clinic that we are at, the MTS clinic that's pictured here on the right. And this is where you'd meet with a pharmacist to discuss, a quit plan and to look into possible medications that you can use to help you come off of cigarettes, or look at nicotine replacement therapy that will assist you with quitting smoking. And you can also, avail of your healthcare provider for any prescribing or guidance to assist you with, quitting smoking. Okay, so that's our spiel on high blood pressure. Now we'll kind of shift gears and discuss high cholesterol. So high cholesterol means, our body over time has built up these kind of like these little deposits. So you can kind of see them here pictured with the construction hat on. They're slowly built up, and they build up over time as we consume more and more cholesterol. Okay, and it causes a narrowing of our arteries due to this buildup of plaque in our blood, and this creates a much more narrow flow of blood flow, and it makes it hard for the oxygen to get around our bloodstream. So having high cholesterol can increase our risk of heart disease, stroke, and angina or chest pain. So that's why it's important to keep our cholesterol under control, and to try to be improving with our diets and lifestyle measures to try to keep it as low as possible. When we talk about cholesterol, there's actually a few different kinds of cholesterol. So cholesterol is kind of an umbrella term that stands for a few different things. So there's good cholesterol, bad cholesterol, and then there's something you might hear, triglycerides is another form of cholesterol. So the names that you may hear for good cholesterol is high density lipoproteins, or HDLs. These are our good cholesterols that we want to be eating in our diet. So we want to eat foods that are rich in HDLs, and by exercising and possibly being on cholesterol medications, they work to help increase our good cholesterol. Okay. Then there's something called bad cholesterol, which is a low density lipoprotein. And this is typically why you're on medications, is to kind of get this down to target and to get it under control. And this is typically what your healthcare provider is looking at when they're targeting your cholesterol. Okay. And with triglycerides, they're kind of there. And, if they do become, if you do get high triglycerides, sometimes, you may go on a medication to try to reduce that. But the bad cholesterol is typically the one that we're trying to get under control with your medications. So we've got another true or false for you to think about. So true or false, you should get your cholesterol checked once you turn 40 years of age. So you can kind of think about it in your head. You can put it in the chat, and then we'll discuss it. So the answer is true. So typically men and women 40 years of age and older should be screened for high cholesterol. There are other considered high risk groups that should be checked regardless of age. So you'll see here, men and women 40 plus in the table should be checked once they turn 40 years of age. This may be reduced. So, you may be earlier in life that you're checked if you are of various ethnic groups that are considered increased risk, such as South Asian or First Nation individuals. Okay. When they discuss, other high risk groups, that's when they're looking at people with diabetes, our current cigarette smokers, someone with, a chronic kidney disease, HIV infection, or a lung condition called COPD. These might be reasons to get your cholesterol checked at an earlier age.
So now we'll talk about the medications that are used to treat high cholesterol. And again, these can kind of be categorized into 4 different groups. So they are statins, fibrates, bile acid sequestrants, and ezetimibe. So we'll discuss those now. So the first group that we'll talk about is statins, and this might be the one that people are the most familiar with because it is the most commonly prescribed. And some examples of these would be rosuvastatin or Crestor, atorvastatin or Lipitor, simvastatin, otherwise known as Zocor, and pravastatin or Pravachol. And these medications work to reduce the bad cholesterol in our bodies, and they also help to protect our hearts. So sometimes our cholesterol might actually be, within target, but we might be on these medications because we have certain risk factors for different types of heart disease. So these will help protect our heart and help reduce our risk of these things happening. A potential side effect of this medication is muscle pains. So if this is something you are experiencing, make sure that you're letting your healthcare professional know, and they can talk with you about how to manage it.
So statins are the main medication that's typically used to try to reduce your cholesterol. And like Melissa mentioned, sometimes people can get side effects from statins, and then they may get switched to a different statin medication. But, if you aren't able to tolerate, a few different statins, sometimes they'll look at other medications. So the other cholesterol lowering medications are a drug called ezetimibe, a class called fibrates, such as fenofibrate or phenomicro, and bile acid sequestrants, or cholestyramine is the name for that one. So these are typically medications used if you can't tolerate statins, or if, say, you're on a statin medication and that bad cholesterol that we discussed earlier, you just aren't able to get that to target despite being on the highest dose of your medication, then they'll add on a second medication, which is typically one of these 3 different drugs to try to get that bad cholesterol under control. Or maybe your triglycerides are really high and they're not controlled with that statin medication, and then they'll add on an additional drug to try to get things under control. And the reason for that is, the statin medications, they've been in a lot of big, study trials where they looked at the benefits of the medication, and statins have really good evidence that support them for controlling our cholesterol, but also for protecting, our heart from heart disease.
So in terms of lifestyle management, there's also a number of ways we can lower our bad cholesterol without medications. And they're largely the same as the measures we talked about with lowering our blood pressure. So going forward, it's really important that we try to make these healthy lifestyle choices a part of our regular routines, and this can help manage our heart health. So I know that we talked a lot about medications today, and sometimes it can be really difficult to manage our medications, but your pharmacist can definitely help you with this. So for example, pharmacists can actually help with blood pressure monitoring. So many pharmacies do have blood pressure monitors available for use that patients can avail of. And the pharmacist is also available to chat with you about your readings. So for example, they might be able to help you incorporate these lifestyle measures, or if you're having different types of side effects, they can chat with you about this. Pharmacists can also help you with medication adherence strategies. So this means, if we are forgetting our medications or we find it difficult to remember to take them every single day, pharmacists can help you with by incorporating blister packs. So you can see the picture here on the right, or dosets, and that's here the picture on the left. And these are just ways that help us remember our medications more, and pharmacists can definitely help you with this. Pharmacists are also available for medication counseling. So, talking to you about your medications, helping you address if you have any different types of side effects. They can talk to you about what to do if you miss a dose. And they're always available to answer, any of the questions you might have about your medications or your health. And they're definitely they're wanting to help you. And the last thing that we will talk about today is medication reviews. And this is something that also pharmacists can provide. And Jeremy will now get into this for you with a little bit more detail.
I'll actually add in a point here too, Melissa. Last night I was working in a community pharmacy, and I had 3 separate phone calls in the evening from a person that was discharged from the hospital. They recently had a heart attack, and all their medications that they were taking, they had so many different changes. They were started on, I think, 3 new medications, and we ended up having 3 different phone calls because, we discuss it, and she'd think about it, and then she'd call me again just to verify all the changes. So we're actually going to schedule a medication review to go through the changes and sit down. And you can have changes in the hospital, but then when you're out of the hospital and you're back home, trying to organize your medications and develop routines for taking them can be really difficult. So we're going to do a medication review and look at ways that she can organize. So potentially looking at dose sets or blister packs to help her with managing this now that she's back home. So we are going to move on to medication reviews. This is kind of how we'll sum up today's presentation. And I just want to discuss the benefits of it through an example of a patient that it's an example patient, not a real patient that would come to, say, our clinic here for a medication review for discussions regarding blood pressure. So we'll use Geraldine as our example. So she's a very pleasant 60-year-old lady that came into our pharmacy, and she has a few medical conditions. So she has type 2 diabetes, high blood pressure, arthritis. She gets heartburn. She had a heart attack in 2012, and she has insomnia or trouble sleeping. Okay. Hold on, I gotta move. I'm in the way here on the Zoom. Okay, let's see. Her blood pressure when she came into the pharmacy was 145/87. So it was a little bit up. So she was wondering if she needed any adjustments to her medications and was looking for some advice. So we decided to do a medication review. So just another little quiz question. What would be Geraldine's target blood pressure? So would it be 120/80 or 130/80? Let's give everyone a second to give some thought about it. So her target blood pressure would be 130/80, okay? And the reason for that is because she has diabetes. So that kind of changes our target. So our targets are typically 120/80 or 130/80, unless otherwise specified. So because she has diabetes, her target is 130/80, okay? So we did a medication review. There's a big list now on the screen, but this just goes to show, a lot of people over time can develop a lot of different medications that they can be on, and that's something called polypharmacy that can sometimes happen, and it's more prone to happen in our older adults who over time may develop multiple medical conditions. They then may see multiple specialists, and then just medications just seem to keep getting tacked on, and that's why medication reviews are really important to kind of sit down and go through each medication and to make sure that they're still needed and that they're still safe for you, because our bodies do change as we age, and so do the effects of medications on our bodies. So just briefly going through, when we talk through her medication, she's on metformin and glycoside, and this is what she takes for her diabetes. She's on a medication called rabeprazole or Periot, and this is what she uses for her stomach. We found out that this was started in 2012 when she was in the hospital after she had a heart attack. Oftentimes people are started on stomach pills when they go in the hospital. Then there's Zopiclone, which is a sleeping pill that she takes at bedtime, and she takes it every night. She's on, the next three there are for her blood pressure. So we have a water pill, a ramipril, and then we have metoprolol. So these three medications are for her blood pressure. And then she's on a rosuvastatin or Crestor cholesterol medication that she takes once daily. So as you can see, these medications are just quite a few there. Then in terms of what she takes over the counter, she takes an Aleve or an naproxen, 2 tablets twice a day, and she takes that for her arthritis pain. And she also takes a Women's 50 Plus multivitamin. That's for a general health supplement. And she also has her Contour Next Meter, which is a blood pressure, a blood sugar monitor. And she uses her strips and Lancets to check her blood sugar. So as you can see, Geraldine's on a number of medications, and that's why it's important to sometimes look at each medication and talk through them and see if they're still needed. So after the medication review, we had some recommendations for Geraldine. So the first one was to stop her Aleve. So Aleve is an anti-inflammatory medication you can buy off the shelf, similar to Advil. Advil is another drug that people can take over the counter that's an anti-inflammatory. So we told her to stop that one, and that's because that medication can actually increase her blood pressure. So the fact that she takes that every day could be contributing to her high blood pressure. So we said, we recommend you stop taking that one and try acetaminophen or Tylenol arthritis. So acetaminophen doesn't affect our blood pressure and would be a safer option for Geraldine. So we recommended that she take 1 to 2 tablets 2 to 3 times a day as needed, up to 6 tablets a day, and then monitor her blood pressure about twice a day over the next week to see if there's any improvement in her blood pressure. Then we also discussed some lifestyle management ways that she could improve her blood pressure, such as regular exercise. Maybe try to go for, again, some brisk walks throughout the week to try to get her blood pressure under control. So besides her blood pressure, we looked at ways that we could try to reduce the number of pills she's taking. So she's actually on 2 medications for her blood pressure that are available as a combo tablet. So sometimes people take a 2-in-1 kind of blood pressure pill. So we recommended that she get switched from taking those 2 pills separately to together as a combination pill. Then if you recall from a few weeks ago when Kelda Newport was here and discussing with Safer Meds NL, there are some medications that have risks associated with them with long-term use. So we noted that she was taking a sleeping pill every night. So we just provided some education that, after you take a sleeping pill every night for about 4 weeks, they start to lose their effectiveness. And then there are some long-term risks associated with them, such as, increased risk of falling, or this kind of hangover effect that you get when you wake up in the morning. So we discussed that with her, and then we discussed some sleep hygiene and provided her with some information pamphlets with the hopes that she'll be able to reduce her Zopiclone use over time. She's also on a stomach medication, which Kelda may have also spoken about. Certain heartburn medications may have risks when you take them for long term. So we discussed those risks with her and discussed reducing the use of her stomach pill. And like I mentioned, she was started on it in the hospital, and that's very common. People get started on it just kind of as a protective measure when they're in a hospital, and then they go home and it just keeps getting renewed, and no one really sits down to look at if that medication is needed anymore. So we discussed ways that she can help come off of that medication. And then the last recommendation we had for, just because we're in times of COVID and everyone's second dose has moved, we helped her with booking her second vaccine appointment to an earlier date now that things are moved off to 8 weeks. So again, that's an example of a medication review. We are located at the School of Pharmacy Medication Therapy Services Clinic. So we do provide these types of med reviews, but your community pharmacy can also provide you with a version of a med review as well. So if you were interested in med review, we do have our number on the screen there if you were interested. And I'm sure Mary can circulate that as well. And I just wanted to give some take-home messages for today. So, looking at, we challenge you over the next week to record your salt intake. Look at the labels and write down and see what the total amount you're consuming in a day, and see if it is above that 2,000 mark that Melissa noted. You would be surprised by how easy it is to get to that 2,000 milligram mark. We also just want to remind you to record your blood pressure readings in a notebook to help know any trends with your blood pressure readings. Because again, that blood pressure is your blood pressure at that moment in time. So if you're ever going into your family doctor or your nurse practitioner and you're getting, a checkup and they're checking your blood pressure, by you having, these trends of your blood pressure, that gives them a better understanding of your blood pressure control, because it may be up that day, but every other day it might not be up. So, that just gives them a better idea of your health. We also challenge you to try to adopt, even one of these lifestyle measures discussed today, such as reducing your salt intake, or even going for, a little 20, 30-minute walk, maybe 2 to 3 times a week, just to get your blood pumping around your body. And again, if you have questions, certainly feel free to ask them today, but talk to your healthcare provider about your heart health. Heart health is very important. And, we all need to keep that in the back of our minds when we're looking at what we're eating and what we're doing throughout the day to help improve our health.
Yeah, just a quick question for you. Quick question. Yeah. It's Bernice calling from the Silverwood Manor. Will these sheets be provided where I can print them out to share them as an educational piece with my staff that work with seniors?
Yes, yeah, Bernie. Yeah, so we'll be providing Mary with a copy of these slides as a PDF that you can print. Yeah.
Okay, thank you.
Sorry, Bernice, we'll also be, this session has been recorded to YouTube. So tomorrow I'll send out slides and I will send out the link to the YouTube recording, because there was so much information today. I think we're going to need the recording and the slides if we want to refer back to it.
And I came on a little bit late there. Came on a couple minutes late. So.
Oh, okay. Yeah.
But anyways, thank you so much. These educational pieces are, I really value these informational pieces because I always share them with my staff after. Which is great.
We encourage everyone to share as much information as you can get.
Yes, exactly.
Yeah, and that was a lot of information, Jeremy and Melissa. Thank you so much. There's one thing that popped into my head during this, a little bit of advice that I usually give people if I'm doing a presentation around wellness or something like that. And when it comes to medication, and I always tell people, like, if you're taking medication, it's something I do. If I'm taking medication, I won't even buy something off the shelf without checking with the pharmacist to make sure this is going to be okay for me to take on top of my medication, right? I think that's really good. I mean, the pharmacists are the people who, they know the drugs.
Yeah, no, that's an excellent point, Mary. We definitely should have. Yeah. Yeah, no, check with your pharmacist because they can look at the medications that you're taking. So, for example, if Bernice had went to her pharmacist to discuss, medications for her arthritis, they would have noted that she has high blood pressure and she has diabetes, and that medication might not have been the best for her, right? Because it could increase her blood pressure.
Jeremy and Melissa, I did have one question that came in when someone was registering. And that was, I'm not sure if you can respond to this or not right now, but anyway, this person says, I have systemic lupus. I'm concerned about the impact of lupus on my general cardiovascular system.
Right. So systemic lupus is a disease that can affect many different organs in our bodies, and of course can affect our heart health. So if they were interested in more information or discussing the medications that they're on, they certainly can make an appointment with us or with their healthcare provider. We won't provide any health specific answers today in this type of environment, but I certainly encourage them to reach out if they're interested.
Great.
Mary, Yvonne had a question in the chat. She said, is it better to take cholesterol pills at supper time? Jeremy or Melissa?
Yeah, so it depends on the cholesterol medication. So some cholesterol medications are long acting in the fact that they last 24 hours in the body. So you could take them any time of day that was convenient for you. If a cholesterol medication is more shorter acting and doesn't last that full 24 hours, then it's best to take it in the evening. So either after supper or at bedtime. And that's because that's when our bodies are making cholesterol, okay? And that's the best time to have that drug working in the body.
What is that noise?
Telephone.
Yeah.
I don't know where the telephone is, so.
No, it's on another person's.
Anyway, Jeremy, another question. Why does the doctor take your blood pressure 3 times with the electronic blood pressure machine?
Mm-hmm. It's a really good question. Melissa, did you want to take a stab at that one?
Yes. So yeah, like Jeremy mentioned, when we take our blood pressure, that's our blood pressure reading at this exact time. And so since like Jeremy mentioned, our blood pressure can change when we, take it now versus in 5 minutes. So it gives us a better idea of the average when we get it 3 times. And so at the MTS clinic, for example, when we take blood pressure, we have a machine that takes it 6 times, if I'm right, Jeremy. You can correct me if I'm wrong. And it just gives us a better idea since it can change, pretty quickly. It just gives us a more accurate reading of your blood pressure overall at this time.
Yeah, that's right. And there's multiple readings because sometimes you can have like an outlier, like one could be really high or really low, and that kind of helps to take an average and to take it into account and get a more accurate blood pressure for you.
Jeremy or Melissa, in response to this lady talking about take cholesterol pills at supper time, she's talking about specifically Crestor.
Okay, yeah. So Crestor is a long-acting medication in the fact that it can be taken any time of day. You'll commonly hear, because some medications have to be taken at supper or say bedtime, that they all had to be taken then, but it's been recently debunked that one can be taken any time of day. So just say you're taking all other medications in the morning, besides that one, you can probably move it to morning to make it more convenient for you if need be. Yeah.
Okay. And Jeremy and Melissa, is there a correlation between a thyroid condition and high blood pressure?
Yeah, so it depends on the thyroid condition. So there are a few different thyroid conditions. You could have a low thyroid, and that can cause your heart rate to be a bit lower, or you can have excess thyroid or hyperthyroidism, and that can cause you to actually have a more rapid heart rate. And again, because our blood pressure, is impacted by our heart rate, then if you have a high heart rate due to that medical condition, you could have an increased blood pressure.
Okay.
Jeremy, is there a connection between high blood pressure and dementia patients?
Yeah, there is. I think Melissa can answer this one as well.
Yeah, so this is kind of on one of the slides we had at the beginning that, high blood pressure can increase our risk of dementia. And that's basically because, we have these blood vessels that go to our brain as well. And, if we have a lot of blood pressure and stuff, it can affect the way the blood travels to our brain and therefore can increase our risk of dementia as well.
Wow. And one other question here, is Zocor a short or a long acting pill?
So Zocor is oh, okay. You still hear me, right, Mary? Knocked off. Yeah, okay. So Zocor, I would probably take in the evening or at supper time. The two medications that I would take, say, any time of day would be Lipitor or Crestor. Those two are the real long acting, the most long acting cholesterol medications. Zocor is kind of an intermediate, so it depends on your dose that you're taking. So it's probably best to take it in at supper time or at bedtime.
Lovely. Any further questions or comments from anybody? Nothing else in chat, is there, Sherry?
There is one more that just came in.
Okay, go for it.
It says, what is the process for stopping a PPI or acid reflux medication? And is weaning process required? Is a weaning process required?
Yes, so a weaning process would be highly recommended. Some people do stop them cold turkey, but basically, because your stomach is getting rid of acid, how I like to explain it is the risks associated with them is our acid in our stomach is like a natural line of defense that we have, from anything that's going into our stomach. So if we're getting rid of that acid, we're also kind of getting rid of that line of defense. So it can actually increase your risk of, or it's associated with an increased risk in pneumonia. So that's one thing to keep in mind. Acid in our stomach also helps to break down the different foods that we eat and helps us with absorption. So if you're getting rid of that acid that helps with absorption, you may get some vitamin deficiency. So vitamin B12, which is kind of like an energy vitamin, can help us make us feel tired. Magnesium as well as calcium, and if you're not getting enough calcium, that can put you at increased risk of bone fractures because your bones might not be as strong due to the lack of calcium absorption. So that's some of the risks associated with them. And if you stop them cold turkey, because your stomach is used to something getting rid of the acid, it's kind of found its own balance now. So once you take that away, there might be this excess acid that's formed from your body. It can cause you to get something called a rebound acid reflux. So that's why it's important to slowly come down off of the medication. In terms of resources to use, Safer Meds NL, if you Google that website, that'll bring you to some excellent resources that you can read through about PPI deprescribing or PPI tapering off the medications. But you would want to come off it over time, and sometimes you might want to get in touch with your healthcare provider to get a prescription for a lower dose. Even you might be on, say, 40 milligrams or 20 milligrams, and maybe they could even help you get down to 20 or 10 milligrams, right? But it is important to talk to your healthcare provider about your PPI use, because there may be a reason that you're on it for long-term use, and you might not be able to come off it completely. It could be you had a history of an ulcer or a bleed in your stomach, and that's sometimes a reason to be on it long-term. Or you could be on a medication like an anti-inflammatory medication that could be really hard on the stomach, and that could be a reason to be on a stomach pill to help protect your stomach.
We have another question here. It says, does taking blood pressure pills affect your kidneys in a negative way?
Yeah, so they can. Like in one of the slides, I believe Melissa's slide, that talked about ACE inhibitors. They're sometimes used for protection of our kidneys. But if we were, say, to start on some blood pressure medications or have a dose increase, sometimes they can negatively affect our kidneys. It's kind of confusing. Sometimes they help, sometimes they don't with kidneys. So yeah, it is possible that some blood pressure medications can negatively affect our kidneys. So if your kidney function was decreasing, hopefully your healthcare provider would kind of look at your medications, and they may recommend a dose decrease in one of your blood pressure medications, or they may recommend changing it to something else. It really depends on the situation, but yes, yeah, it is possible.
Thank you.
Is that it, Sherry?
That's all. That's the questions that are in the chat.
Oh, thank you so much. And thank you, Jeremy and Melissa. One thing I forgot to mention when we talked about sending out some material tomorrow, we will also be sending certificates to those who requested it. And that goes for any of our sessions. You know, if you attend as part of job-related professional development or post-secondary education, we will happily send you a certificate. And coming up next week, we're going to have a mediator on board, and the topic will be elder mediation. So I'll be sending out the invitation to that later on today, and maybe we'll see some of you here again. Thank you, everybody. Take care and stay safe. Thanks, Jeremy and Melissa. Really appreciate it.
Thanks so much. And thanks everyone for attending.
Thank you.
Bye, everybody.